Hi, everybody. My name is Rocio Reyes. I'm from Colombia, from ACELA, Asociación Colombiana de Esclerosis Lateral Amiotrófica. I'm very proud to be here. Well, I'm going to tell you about about ACELA, what do we do, what have we accomplished, and our expectations and goals. Okay, that little country over there in South America is Colombia. It's my beautiful Colombia. About ACELA. ACELA is a non-profit association dedicated to promote the quality of life and well-being of people with ALS and their families. It was established in May 2008 by my proudly husband, that we have lived, now we live with ALS for 17 years. He's over there. He's there in the wheelchair. Okay, and we have been full members of the International Alliance since June 2010. Our volunteers. Well, that's my husband also with all his women. We have a permanent leading team, volunteers who have experience with ALS in their life as a patients and caregivers. We work with all our heart because all of us knows how it is to live with ALS. So that's what we do. We help people, we tell them what to do, how to do it. We have an additional team of professionals with assisting patients and families as a neurologist, nurse, psychologist, pneumologist, and the last, a lawyer. I will tell you later why it's so important. Sometimes for us in Colombia, it's more important to have a good lawyer than a good doctor. I will tell you later in the presentation why, that's why. Okay, here in this slide, I'm going to I make a pie about active members distribution. 55% of our active members are male, 45% are female. Their ages, 56% are between 30 and 65 years old, 41 are older than 65, and just 3% are younger than 30 years old. The stage of ALS is half of our members are in the middle stage, 41 in the late stage, and just 9% are beginning with the ALS. The 73% takes the medication. For us, that's a big number, and that's why we have a good lawyer. Okay, it's a mandatory that our government give us all the facilities, all their help. But it is mandatory, but that's not true, that they don't do it. So that's why we have to have a good lawyer to fight for our rights. It's a right. And the government say, you have the right to do it, you have the right to have it, but that sometimes doesn't happen that way. So, like I told you before, that's why we have to have a good lawyer. Okay. Our coverage. We cover all Colombia. Usually in our big cities, all year around, we go to the big cities to do our workshops. We go to give information, to meet the other patients that can go to Bogota, where we are. All our volunteers live in Bogota right now. That's why we also have to do more information to those volunteers that wants to be in the other cities, so the patients won't feel lonely over those big cities. Our needs. As you can see, the 80% of our patients, the healthcare system, they have a limitation with the healthcare system. That's why I told you before the lawyer. For us, it's very important, that part. Limited information. Why? Because they live in a very far away city. They don't have any internet. They don't have even, sometimes they don't have a doctor. So the information that's a big issue over there, the information. Patients with no life plans. They just, when the doctor tells them you have ALS, the doctor what says? You're going to live just 3 months, 2, 5 years. So the patient doesn't want to do anything else. You just go on bed and wait to see when it's going to happen, and that's it. Limited integral care. 90% of our patients have limited integral care. We have limitation in the transportation limitation, not timely treatment, and limited support, home care support. What it is? We don't have a nurse, bed, chair, etc. Also, as I told you before, it's mandatory that the government give us that, but they don't do it. So what we do is, what the ACELA does is, we go to the patient, we go to the families, and ask them what they need. When we know what they need, so we can help them, okay, we get some donations from other patients that they are not with us anymore, and the family give us that as a donation. So we say, okay, we have a chair, we have medication, we have beds. Sometimes we give beds also to that families. Food, and more important thing, company. We give them company. And a plate of a dish of food. Sometimes they don't even have any food to do it. So if they don't have food, how they are not interested to get any medicines, because they say, I don't want to be here, I don't want to that my family suffer with me. They can't work anymore for me because that family has to be with me. So that's what we do over there, to tell them, don't worry, we know how you feel, we do this, we're going to give you company, we go over there just to talk, just to read a book for them. Because even sometimes our patients doesn't know to read. They don't write, and they don't read. So that's a big issue for us. 90% of our patients have transportation limitations. Public transportation is not suitable for ALS, and they don't have economic resource of using private vehicles. What do we do? Due to uncertainty and fear of how to live with continuous increase of physical limitation and the lack of information of how to charge daily routine, we promote well-being of each stage of ALS. We inform, we build, we link, and we are reciprocal. We inform. We provide useful information of clinical progress and how to live with ALS and caregiving programs. That's a big program in ACELA, the caregiving programs. We build. We join forces and see strategic alliances. We have here, we work with the big Universidad Nacional de Colombia is the big university and the best university in Colombia. International Alliance of ALS. All of this is for information. I think for us in Colombia, we think it's very important that our patients has a good information, has the right information, so they know what to do. They will know the rights to fight. We link. Okay, those patients over there, they are the two founders. They were the ones who start the association. I'm going to be fast, sorry. We link. We want to give, receive support to meet the special needs of ALS patients and their families. We give them, as I told you, medicines, share, company, advice and feedback, and economical support. A lot of economical support. What have we accomplished? Okay, we empower patients. I'm going to tell you very fast about this. In August 2008, we were just 2 families and 2 volunteers. 2 families, my husband and another patient, and the 2 volunteers, his wife and me. And in December 2016, right now we are 200 associated families. We have helped more than 1,000 supportive, we have helped more than 1,000 families, more than 20 demands volunteers. Right now we are 10 permanent volunteers, 10 alliances with different entitles, and we have a very active media, social media. We are proud of our improvement, but we want to do more. Our expectations and goals: to have our own headquarters, to have a transportation for patients, increase alliances, increase national coverage, increased national coverage. As I told you, we have Los Andes, all in the middle of Colombia is the Andes. So there are a lot of patients that we don't know about them because they live in a really far away towns. Sometimes they don't have, like I told you, internet, they don't have electricity, and they don't have medicines. So it's our big issue to go over there and help them. To policies, to contribute to public policies for people with ALS. Continue sharing love and hope, and we want to share our experience with other institutions and research studies. Thank you very much.
Thank you very much. How do you pay all the work you're doing? Are there all volunteers, or do you also fund some money to do this work?
Volunteer. We say in Spanish, arañamos. We try to get any money, any help from anybody. Sometimes the healthy families give us, who has their families help, patients have died with ALS, and so they help us. Sometimes we go to these universities or to the big companies to get the donation. But 80% it has to be from our pocket.